Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute, Hyderabad. Today's video is on vitamin B12 deficiency and its role in erectile dysfunction. So now if you know, vitamin B12 deficiency is very common in India, and particularly this is very common in vegetarian people. See, normally this is a vitamin B12 deficiency is not common. That means it's not seen in people who take non-vegetarian food. So normally non-vegetarian foods like egg, fish, chicken, they have vitamin B12. But certain set of people who are taking regular non-vegetarian food, but still they have vitamin B12 deficiency. So there the issue is with the absorption of vitamin B12 in the bowel, small bowel of the body. So now these patients have to be treated separately, and people who are pure vegetarians and who has non-vegetarian B12 deficiency, they have to be treated separately. So now what we have to understand is why vitamin B12 is important. So vitamin B12 is related to vascular health. Vitamin B12 is related to bowel related issues, and vitamin B12 is related to muscle growth in the body, muscle growth, and which is again directly related to your bone strength. So now what happens when there is vitamin B12? So one, it affects the inner layer of the blood vessels in the body, which is called endothelium. So endothelial dysfunction, then when this inner layer is damaged, we call it as endothelial dysfunction. When there is endothelial dysfunction, then the first organ, one of the first organ to get affected is the penis. And the erection mechanism depends on the endothelial function, where the nitric oxide absorption takes place. When there is endothelial dysfunction, obviously it affects your nitric oxide absorption, and which in turn causes erectile dysfunction. Second problem which comes through B12 deficiency is homocysteine elevation. So now whenever homocysteine increases, what happens is the blood becomes thicker, and when the blood becomes thicker, then it can't pass through the smaller blood vessels in the body. So then, which is again a dangerous issue, which can cause heart related issues, which can cause stroke in the brains, and all these issues are caused by high homocysteine levels in the body. And this homocysteine is again related to B12 deficiency. And that is the reason this B12 homocysteine, high homocysteine level in the body is one of the primary cause for heart attacks in pure vegetarian patients. Sometimes we will be seeing a patient is very thin, regularly exercises, but when he gets heart related issues or heart attack, people think why this person has, because he has no other habits, he has very good lifestyle, but still he gets heart attack only because of the reason high homocysteine levels. So now these vitamin B12 deficiency can be corrected in two ways. For people with B12 vegetarians with B12 deficiency, they can take B12 supplements in tablet form. There are so many over-the-counter medications which can be taken, like Neurobion. There are various brands which comes in tablet form and film form or syrup form. And if you take this syrup, then vitamin B12 level will increase. And then there are certain vegetarian foods which can increase B12, but there are very few. You have to talk to your dietitian, and if possible, if absorption is is okay with your gut, then probably you can depend on those foods, but they're very few. But the main issue comes in non-vegetarian people with vitamin B12 deficiency. That means their absorption mechanism is very low. So now the only way to correct B12 in these people is taking injections. Oral medications or any other form of oral tablets or syrups or films may not help these patients. They have to take either IV or IM injections, and these injections are very common. Any doctor, any MBBS doctor can prescribe this injection. So you have to consult your family doctor and get your vitamin D, vitamin B12 levels corrected. So now my suggestion is, since this is directly related with vascular health, so at least once in 3 years, every 3 years, once you cross 40 years, every 2 to 3 years you have to do vitamin D and vitamin B12 and homocysteine regularly to check your vascular health and cardiac health. So this is also a marker for your cardiac health. That means if homocysteine is on the higher side, then you are in high risk zone. So now you have to, every 3 years you have to do these tests. If they are on the higher side, you can consult any physician. You don't have to come to an andrologist or cardiologist for these issues. Any physician can treat you for these deficiencies. So now people with erectile dysfunction, any age group, not only 40 plus, any age group, along with lifestyle modifications, along with their testosterone or regular hormonal evaluation, they have to check these three, they have to do these 3 tests, so which will help in curing their erectile dysfunction. One is vitamin B12, vitamin D and homocysteine. And here vitamin D and B12 are important for sperm production also. So people with infertility issues, we do B12 and vitamin D. People with erectile dysfunction, we do vitamin D, homocysteine and B12. And people with premature ejaculation, again vitamin D and B12 has a role. Generally we don't do homocysteine. So viewers, thanks for viewing. If there are any other queries regarding these vitamins and its role in erectile dysfunction, sexual dysfunction, please post it in comment sections. We'll try to make new videos. And thanks for watching, and please subscribe our channel.